Good morning, all my friends and my colleagues and my fans and my students everywhere, to all the healthcare professionals and healthcare providers, doctors, and allied specialities and allied disciplines. Today I will talk about fever in clinical practice. This is my first episode in fever. Fever, as we all know, is a major hallmark to clinical disease. It is a major hallmark to clinical disease in most of the situations. And fever is elevation of body temperature above the normal range limits. And as we all know, the fever is not always due to an infectious process, although most of the cases of fever, or most of the febrile, we call the one who has fever febrile case. Most of the febrile conditions in clinical practice are due to infectious causes, yes. But not all. Some, or we can say even in many situations, many cases of fever are not due to infections, or what we call the non-infectious causes of fever, or non-infectious origin of fever. First of all, we have to talk about the normal body temperature regulation. The body temperature regulation is normally regulated by a system in the brain. We call it the thermoregulatory system complex, and this thermoregulatory system complex is located in the hypothalamus of the brain, which hypothalamus is part of the diencephalon and is the most important neuroendocrine modulator in the central nervous system. It is part of the limbic system, and it is part of the endocrine system of the brain, which regulates the rest of the endocrine system of the body. It is part of the autonomic system of the body. The hypothalamus is an important homeostatic organ responsible for regulation of the internal milieu of the body, and part of the internal milieu of the body, or the homeostasis, is the temperature. That's why the thermoregulatory system complex, or sometimes we call it thermoregulatory center. Its center is oversimplification. It is rather a big system. It is bigger than being a center, and this system complex with thermoregulatory, we call it the thermoregulatory system complex, and it is a group of receptors and a group of nuclei, and many neurotransmitters are playing a role in this thermoregulatory system, especially the cyclic MP, in addition to the monoamines and also cations, the sodium and potassium, and other interrelated neurotransmitters. All are playing a role in this small but it carries a big network of nervous tissue and the nuclei regulating the temperature of the body. And it has receptors, of course, as I mentioned. It has nuclei, neurotransmitters and receptors, and all also have connections with the higher levels of the brain and with the other parts of the brain and the lower levels of the brain, and then with the rest of the body and other body systems. This is the thermoregulatory system complex. Thermoregulatory system complex, it regulates the body temperature, or it keeps the balance between the internal temperature of the body and the current temperature, to keep it in a normal range around what we call the set point. To keep it in the normal range around the set point, or the temperature set point. The hypothalamus recognizes any changes observable between the internal temperature, or what we call the core temperature of the body, or the blood temperature, and the temperature outside the body, that is the external body temperature, and the external body temperature reacting with the environmental factors around it, that is the external environmental temperature. So the hypothalamus and the thermoregulatory system complex plays this role to regulate and to keep the balance between the internal body temperature and the external body temperature, which reacts with the external environmental temperature, which are affected by physical and chemical factors outside the human body in the environment around us. So when we say the temperature, what concerns us about the normal temperature? Normal temperature, we all know it is in the range of 36.6 up to 37.2, or according to some authorities, 37.4. This is the temperature set point and the temperature, body temperature range. And we should know this is as regards the core temperature, which concerns us. The core temperature is the most important. When we say fever, we mean elevation of the body temperature. The core temperature is the one. We have to measure the core temperature, not the external temperature, because the external body temperature gives fallacious and misleading results about the internal body temperature, which is the temperature in which the different or under which the different biological cellular functions are regulated physiologically. All the body functions and the different biological functions at the level of the cell and at the level of the organs, they keep regulated and they keep functioning under certain temperature range. This temperature range should be kept in order that these body functions will work properly. They will not be outside the normal control. That's why this temperature regulation depends on the balance between what we call temperature generation or temperature production by the body, which depends on the body metabolism, of course, and the basal metabolic rate, or the PMR. And on the other hand, what we call the heat dissipation or heat dissipating mechanism. So it is a balance between heat generation or production and the heat dissipation. Any imbalance between these two processes either increase the heat production or diminish the heat dissipation, there will be imbalance and production of more temperature and the generation of hyperthermia or fever. Any imbalance between heat production or generation on one hand and the heat dissipation on the other hand. Also, sometimes the fever, it's not related to a dysregulation of the thermoregulatory system complex of the hypothalamus. It is due to a production of what we call endogenous pyrogens. Sometimes it is due to endogenous pyrogens. And this is the mechanism of fever. Either it is dysregulation of the hypothalamic thermoregulatory system complex, or what we call the hypothalamic thermostat. It is dysregulated by local factors in the brain, or by factors coming from outside the brain, so causing at the end hyperthermia or fever. Another important mechanism in the pathogenesis of fever is the production of what we call endogenous pyrogens, or the ERs. And the endogenous pyrogens, the most important endogenous pyrogens are the interleukin-1 and the tumor necrosis factor alpha, and the interferon alpha and beta. So the interferon and the tumor necrosis factor alpha and the interleukin-1, they are the major endogenous pyrogens, which might be stimulated by factors produced either endogenously inside the body or coming from outside, that is from exogenous sources outside the body. Whether endogenous or exogenous, these endogenous pyrogens at the end will affect the brain and or affect also the hypothalamus, and they will generate fever. So whether it is thermostat dysregulation or production of endogenous pyrogens or both, these are the major two mechanisms playing a role in the pathogenesis of fever due to a clinical disease. Fever is a physiologic response. This is another important point. It's a physiologic response to an insult, which is either produced inside the body, that's coming from inside the body, as it happens in, for example, autoimmune inflammatory process. This is an endogenous process which starts within the body, so it is an endogenous stimulus. Or endogenous stimulus to fever, to hyperthermia. Or it is a physiologic response to an insult which comes from outside the body, like what happens in all of the infectious causes of fever, which is the commonest cause of fever, infections, whether like viruses, bacteria, fungi, mycotic infections, the parasitic infections, whatever, or other foreign bodies coming from outside or foreign substance coming from outside the body, maybe food, maybe insect bite, maybe animal bite, maybe any of the factors which come exogenous, and so the body will react to it by fever. So it is a physiologic response to an insult which is threatening the body either from inside it, that is endogenous insult, or from outside, that is exogenous insult. So it's rather a physiologic response. It is not a disease by itself, fever. Fever is a manifestation. Fever is a hallmark. Fever is just a denominator, a warning a manifestation, a warning, a symptom and sign, because fever is both a symptom, subjective, and sign, which is objective. But it is more accurately to be considered an objective, because some people, they misinterpret the temperature elevation as a fever without being objectively calculated and measured by a well-calculated and well-calibrated thermometer, which must be used for checking the body temperature accurately. And more accurately to detect what we call the core temperature, that is the blood temperature, which expresses the internal body temperature, which denotes whether there is a disease state or there is no disease state. This is about the fever and the regulation of temperature, and the mechanisms, or the summary of the mechanism of fever or hyperthermia. We have to know that there are different grades of or severities of fever, or different magnitudes of fever, and also these different patterns of fever. And this is very important. When we analyze or when we are confronted with the case of fever, we have to assess exactly the magnitude of fever or the severity of fever. Is it low-grade fever? Is it moderate fever? Is it high-grade fever, which is fever more than 39 and more than 39 degrees centigrade, or is it what we call hyperpyrexia, which is temperature or fever above 41 degrees centigrade, and this is the most dangerous, the hyperpyrexia. So there is low-grade fever, high-grade fever, and hyperpyrexia. And as we mentioned, the fever is hyperthermia. So we have to differentiate between these terms clinically: hyperthermia, the low-grade hyperthermia, high-grade hyperthermia, and the hyperpyrexia. Hyperpyrexia is an exaggerated hyperthermia with body temperature above 41 degrees centigrade. We call it hyperpyrexia. So this is the differences in the clinical terminology related to fever. And another important point is what we call the pattern of fever. We have what we call continuous or sustained fever. We have intermittent fever. We have remittent fever. We have hectic fever. We have relapsing fever. These are different types of or different patterns of fever, Each of them might denote certain disease process, and they are especially important in the analysis of fevers due to an infectious disease, that is, infectious causes of fevers. Certain infections causes certain types and patterns of fever, depending on the underlying pathogenic factor or pathogenetic factor, especially bacterial infections. They cause different patterns. Some of them might cause continuous or sustained. Some bacterial fevers or infections cause intermittent fever, and this also happens in some parasitic infections and some viruses. Some other infectious agents cause what we call the hectic fever, and some cause the relapsing fever, and we have a group of fevers, we call it relapsing fever. So it is related to the underlying pathogenetic mechanism of fever, especially in infectious fevers or fevers of infectious origin. This in short about the temperature regulation, types of fever, the analysis of fever, the difference between the internal body temperature and external body temperature, what is the core temperature and what is the external temperature, and the exact nature of fever. Remember that most cases of fever are infections or infections and infectious processes. They form most of the fevers in clinical practice, and most common are viral infections. So viral infectious diseases form most of the feverish or febrile conditions which we see in clinical practice, and they constitute most of the bulk of feverish patients which present or who present to us in the clinical practice in the emergency room or in the OPD. Let us now finish this episode, and I will continue to talk about the fever in my next episode.